Okay, so welcome everybody to another podcast from the Just a Chat team. Today we have Dr. Mark Doyle.
Thanks for inviting me along today.
Thank you for coming
privilege.
down. Yeah. Basically, we've had a wee bit of feedback online from the Facebook, and there's a lot of people want to know a lot about sort of anxiety, depression, tips for self-care. So this is where Mark's going to help us. Hopefully, we're just going to ask a few questions, go through what he does, the benefits of self-care, how to deal with depression, anxiety, the differences and things like that. So, do you want to give us a wee bit of a background as to what you do then, Mark?
Yeah, so I'm a psychologist and cognitive behavioural therapist. I do a lot of work with anxiety, depression and trauma. My experience is traditionally in occupational health, so I spent about 3 years in the Belfast Trust doing that. I also worked in AMIC, an acute mental health inpatient unit, for about 9 months as well, so working with a range of personality disorders, hearing voices, forensic clients, wide range of different sort of problems, and primarily using a range of cognitive behavioural therapy and compassion focused therapy.
Perfect. I think sort of my first question that probably not on my own, psychologist, psychiatrist, they're all sound the same. What counsellor? What's the difference in all those? So
okay, so look, you're not on your own in terms of kind of getting confused by all those differences. It's very common. I still get those questions all the time. So the difference between a psychologist and a psychiatrist first. A psychiatrist usually has a background in medical training, so they've done a medical degree and then specialise then in psychiatry. So they'll primarily look at things like medication in terms of their support for you, though they may also recommend certain programs that might be helpful as well. On the other side, we've got psychology, which is much more about talking therapies. So things like cognitive behavioral therapy, which I provide, but also things like EMDR, psychodynamic therapy, and other more third wave approaches like acceptance and commitment therapy and compassion focused therapy as well.
Okay, perfect.
So counselling as well can be slightly different. So counselling is where you have someone would be led in different types of approaches. They probably wouldn't have the same level of training or qualification as someone like a psychologist or psychiatrist. But they provide a fantastic service in terms of things like bereavement support and helping people manage and process through grief and other distressing problems.
Okay, so I need some sort of help. I don't know what I need. Everyone assumes I need to go to GP, then I need to go to counsellor or whatever else. Yeah. Can a GP get me in touch with you?
In touch with a cognitive behavioural therapist?
Or can he make that decision as to which one I need?
He sort of can and sort of can't. It depends on the GP and their own understanding of difficulties.
Okay.
Generally, one of the ways that we try to work this out is the severity of your symptoms and the difficulties you have at any one time. So there are a couple of measures that we would use in clinical practice that really help us see where are you on that scale. So the first one is PHQ-9, and it is a depression measure. If you just put into Google phq9.pdf,
well, we'll probably put a link underneath this in the description, whatever, a link to all these surveys and stuff that Mark's saying. So don't worry about taking notes on that. So we'll detail that.
Okay. So basically, where you score in that will give you either if you're into the mild, moderate, or severe range. And depending on that, it kind of suggests what you need help and support with.
Or it suggests for you, right?
It will suggest based on that what's the most helpful thing. Also, there's an anxiety measure called the GAD-7, which is GAD-7. It's a measure of generalized anxiety, but it covers a lot of underlying processes of anxiety, so it kind of captures quite a lot. So those two measures are what you would normally be, expected. If you go to a therapist, they'll get you to kind of fill those out and see where you're at on that, and then they can work on a more personalized plan for you. Even just doing those measures gives you an idea of the severity of your difficulties, and if it's in that kind of moderate range, you're probably mild to moderate range, you're probably going to need something a bit more like CBT. If you're in the severe range, you might need to see something a bit more like a...
Can I do those forms and get assistance if I'm slightly feeling a wee bit depressed or something? Or I know a lot of people don't really reach out for help and stuff until they're crisis, you know, and that's what sort of we try to cover. And even at the beginning, if you can do them surveys now, just as a test, sometimes you might be surprised at the outcome, and then you can get stuff in. It might be a good idea to fill one out myself.
Definitely think it's a good idea, and even whenever you're trying to get help and support, it's always still good to try and check out where the support's available in your local area.
Yeah.
So there are some like crisis intervention services like PIPS, Lifeline that are always great to get help and support with. Lifeline also have a limited capacity for therapy as well in terms of counselling support. So there is some help and support there when you're at that crisis point. But you're absolutely right. You don't want to get to that point. You want to make sure that you're preventing yourself from getting yourself to that point. Counselling is always the kind of first step to try and help give you the opportunity to speak about your problems and talk about it. You can also voice whether you think something at a higher stepped part of the step care model is needed. So one of the things that we kind of look at in therapy is, are you getting the right type of help and intervention at that point? So at step one, you're kind of looking at things like self-care, looking after yourself, trying to prevent things from getting to a point where you're in crisis. Step two might be something along the lines of bereavement support, kind of going along to groups and that kind of thing. There's some really great things at that level too. And so counselling would probably be at that level too. Step three is more likely we see things like high intensity cognitive behavioral therapy, EMDR, acceptance and commitment therapy. There's a wide range of different types of therapies there that would be more for the higher end of the severity scale. So that would be for things like PTSD, depression, health anxiety, OCD, specific conditions where you would need psychological therapy for, and perhaps the inclusion of things like psychiatry support as well.
I think one thing we've mentioned a few times is CBT therapy. Yeah. What is it?
Okay.
Just straight up, what is it in a nutshell? Yeah.
Okay, so CBT is cognitive behavioral therapy. It was created by Aaron T. Beck and Albert Ellis. They basically looked at how our thoughts and our behavior leaded to the stress and emotions and how we feel in our body. And usually it's based out of the meaning that we have for a certain event. So imagine you're walking through the town and you've seen someone that you know really well walk past you, and they didn't say hello. You might start thinking to yourself, have I done something to wind him up? Have I done something to really upset him? And then you start getting yourself into that loop in your mind.
I think everybody will relate to that, yeah.
Yeah. So that's your meaning you've taken out of, I've done something to upset this person. So how you feeling in your body? You're feeling very tense, you're getting really sort of agitated, and you might even get so really upset with yourself, you might go home. You might just not want to do anything because you're to rack your brain trying to think, what did I do to this person? Or you might text them and say, here, what's the crack? Okay. So what would happen if you actually thought slightly differently? What if you thought they're having a bad day? You might not come with the same negative outcome for yourself. So the meaning and the thoughts that we have a huge implication for how we actually deal with our lives, the situations we find ourselves in. But primarily in CBT, we work with our thoughts and our behavior because we believe they've got a knock-on effect on our emotions and our physical sensations. We can't jump in directly to go, right, I'm going to turn down my sadness here and turn up my joy, or I'm going to remove all physical sensations of distress and suffering. We've got to do it at the thought level and the behavioural level because ultimately they'll make a difference on the other sides.
Right, perfect. So you don't get wired up to machines and everything?
No,
because I think as the movies tell us is that you're going to get all these brain waves and forms.
Absolutely not.
Right, okay. So it's basically another sort of level of sort of counselling, more extreme.
It's a talking therapy.
Yeah.
But it is much more problem focused, short term, and has strong research evidence behind it as well. It is one of the most heavily researched form of therapies, and that's why it's recommended by the National Institute of Clinical Excellence. They're the kind of regulatory body that recommends the right type of therapy for particular difficulties.
Okay.
So there's not very many therapies that are recommended, and CBT is one of them.
And does CBT work with depression, anxiety? Which would it sort of help more of?
CBT is applied to all of those things. Okay. CBT is the most flexible type of therapy because you can basically apply thoughts and behaviours to anything. You know, how you thinking about how you're driving, going to work, how you thinking about sports performances, how you thinking about your relationships with the people around you.
Everyday situations.
Everything.
How you deal with it, yeah.
So you can take that situation and break it down and try and work out what would be a more helpful thought here, what would be a more helpful way of engaging and acting at any given time. Do I need to be a bit kinder in these certain situations? Am I being kind enough to myself in these situations? Because we can all be really vulnerable to things like self-criticism, and unfortunately that leads to a lot of mental loops and suffering, and yeah.
And it probably goes hand in hand with self-care.
Yeah.
Like if you don't look after yourself and you walk past that person in the street, your day is probably going to be a hell of a lot worse than if you were looking after yourself.
Yeah.
So it's sort of, it's not the end all, the be all. It's sort of self-care is maybe step one.
Yeah, self-care is always step one.
And the self-care, like I know we're talking about depression and anxiety in a wee second, would that be probably the most important thing before you go get help?
Yeah.
Yeah.
So these are things that you should be trying to build into your day anyway. For any of us, whether you're really struggling or not, these are things that look after ourselves and treat ourselves with value and compassion. But they're things like learning things, connecting with other people, having good quality social contact. One of the things we note with things like depression is that the more isolated you are, the more likely you are going to struggle with depression. That is just de facto.
It's just you and your thoughts.
That's it. Yeah. Because you're going to be ending up ruminating about
So
things.
say I am on my own. Say I don't have a big circle of friends and family and I am suffering with depression.
Yeah.
So what self-care things can I do to cope with that sort of depression, you know?
Okay, well, one of the first things that we do in therapy is a thing called behavioral activation. It's a fancy term, but basically it's planning and scheduling in things that relate to achievement things, enjoyment activities, and closeness to others. So if you're spending all your day in the house and you're not doing very much, your likelihood for your mood being very low is very high. Okay, so one of the things we do then is start scheduling in so there's not big gaps of you doing nothing, because you're likely to be worrying and ruminating.
What if, for example, I have a child, I have the house to sort, I need to do dinner, I don't have time for all this.
Okay.
So where do you go with that? Because a lot of people do think like that, and that does happen.
So then it's thinking about where can you create some time for yourself? Is there someone that can give you some respite? Is there someone that can come over for 10 minutes for you to do a mindfulness session, even in the room next to where everything else is going on? It's trying to build out those times and try and find that bit of respite and support wherever you possibly can. And sometimes we de facto make justifications and excuses for ourselves at times where we just don't think we're worth making that time for. And I think those justifications are particularly in line with depression, because when you're not treating yourself with value and compassion, you know, it's not going to lead very well. It's going to lead to a lot of extra suffering and pain for us.
And what about anxiety then? I think we're sort of covered as in that's sort of what brings on depression, what makes it worse and stuff. But in terms of the same situation with anxiety.
Yeah, so how you cope with it.
You know what is anxiety?
So anxiety is an emotion. So that's the difference already. Depression is usually seen as major depressive disorder. That's the actual condition that you would be diagnosed with if you went to a psychiatrist for it. Anxiety in itself is an emotion, and we all have anxiety. In compassion-focused therapy, we have a thing called a threat system, and it's basically what we all have, helps keep us alive. Its basic motivation is harm avoidance, keeping us surviving throughout things. The emotions that come with that threat system are things like anxiety, anger, and sadness. But the anxiety has a function for us, like any emotion.
Fight or flight.
Fight or flight is the behavioral aspect of it, but the emotion tells us that there's something wrong in the environment that's going to cause us distress. But the problem can be when we have our part of our brain called our new brain, which is this part here at the front, the prefrontal cortex, where we do all our thinking. So it links to when we start overthinking things, imagining worst case scenarios, imagining the most awful thing happening to people you care about. Our brain will then switch into kind of that threat system and will kick off all those really horrible emotions that we struggle with. The anxiety, the anger, the sadness. And with the anxiety part, we will then get trapped in those loops of I'm imagining this worst case scenario, brings up all the anxiety, And then what can happen is we can give ourselves a lot of grief for feeling anxious about it, or for thinking that way. So I'm so bloody stupid for catastrophizing. I'm so bloody stupid for being anxious all the time. So when we start criticizing ourselves that way, it actually makes it worse, because it fuels it to keep it going and keeps it going longer.
And this is all about sort of how I feel anxiety and what is anxiety. But say, for example, I have anxiety.
Yeah.
How can you see that? As in, say, for example, how can me as a partner see it in my wife? How can you as a friend see it in your friend? What are the things to look out for?
Okay. So depends on how your anxiety presents itself, because we are different profiles of anxiety. We have things like generalized anxiety, which is usually characterized by just lots and lots of worry. You could have panic attacks and panic disorder, which is where you kind of react really strongly to physical sensations in your body. So for example, you would have, say you could have a lump. That's something like that. But if you were like feeling your heart beating a lot faster, you might interpret that like you're going to have a heart attack. So then every time your heart starts beating a little bit faster, you start thinking, I'm going to have a heart attack.
Anxiety kicks in, and then it then becomes,
so it becomes that mental loop. And so then even if you're walking and you just notice your heart beating a little bit quicker, you're going to start freaking out and reacting more and more and more to that until you start not going anywhere. And then that's maybe where you got the crossover with depression.
And then depression, the loneliness and all kicks in.
It's very common for those two to coexist together.
So it makes sense. Yeah. And if I feel anxiety coming on, how can I not nip it in the bud, but how can I attack that like quickly before it spirals, before the snowball effect?
So it really helps to understand what's been going on before that, what's been going on in your environment, what's been going on in your head. But generally we're jumping in to try and down-regulate that threat system as much as possible. There's a great practice called soothing rhythm breathing from compassion-focused therapy, and it's just a calm breathing technique to try and really slow everything down. You can look at things like box breathing, which is good as well, but even just slowing your breathing down and primarily focusing on your out-breath, it can be really, really helpful. So breathing in for 4, holding for a couple of seconds, and then breathing out as slowly as you possibly can. Really taking the time with that, and then breathing in again for the 4, and just getting into that cycle can be really helpful. Another great strategy is grounding techniques. There are a range of different types of grounding techniques. There are physical ones where you can rub your hands underwater, so getting that tactile sensations. You can rub it on your face, throw water on your face, rub it around the back of your neck. Cold water immersion is really good. You can see that getting really popular at the minute. That's a really, really good one. But the one that I would teach for clients as a cognitive way of distracting yourself is looking at 5 things you can see, but you have to take it really, really slow and describe them in as much detail as if you were trying to paint a picture for a blind person. You were trying to get them to see that image in their head with as much detail as you possibly can.
Can you do this when you're on your own?
You can do this anywhere.
Is it best to do it aloud if you're on your own, or into yourself?
You can do it in your head. It doesn't really matter. No one can even notice if you're doing this, because it would be something as simple as describing that door. You would look at it. What height is it? What color is it? You would think about the small little details, the arcatives. You can see the safety glass, the hinges, all details you can possibly do before moving to the next one and the next one and the next one. And then you go to 4 things that you can hear, and you focus on those for a little bit at a time. Then 3 things that you can feel in your body. So like, for example, you'll be focusing on your feet on the floor, and imagine everything that you can feel in your feet, everything you can feel when you're back against the chair, your hands and your hands together, all those little tingles, sensations,
shoes, your gloves,
all those tactile sensations. You can get fidget toys, run them in your fingers, play with fidget toys, that's part of that too. And then 2 would be 2 smells. In CFT they use a thing called compassionate smells. Things like using lavender is a really powerful technique. So even putting that on your pillow, putting it on inside of your shirt, even a smell that has a strong, safe feeling to it, even if it's something like a fabric softener that reminds you of your childhood and being really safe and secure.
Could you do anything, just anything that you like?
Yeah, anything you like. As
Chocolate?
long as it has the feeling. Chocolate, possibly. It might make you hungry.
Yeah.
But something that kind of gives you that feeling of settled
Yeah.
and feeling safe. And then the last one is probably the most difficult out of it. One thing good about yourself. And a lot of people will struggle with that because if they're struggling with depression or anxiety, they're likely to be very critical of themselves. But basically, you take the time to focus on all those things because it gives you a chance to refocus your attention on something else. This isn't going to cure everything for you, but it will give you the opportunity to point your attention somewhere else, like a torch. And that's really important for you whenever you're struggling with your mental health, is using your attention like a torch and thinking, what is it I'm thinking about? If I'm worrying about all this stuff, but I'm not doing anything about it, if I can't do anything about it, how helpful for that for me is that? How helpful is it for me to just play over those horrible, shameful experiences in my past again and again and again? You've got to become your own best expert at noticing where your attention is and then placing it somewhere else that will hold your attention. And it doesn't matter whether it's playing football with your mates, playing games online, listening to music, going to martial arts. It doesn't matter as long as you go and do something that takes your full focus of your attention.
I would have a really bad memory, right? Anybody that knows me would just like, what are you even doing? You're secretary or whatever.
Okay.
Now, if I walked out of here in 10 minutes, I'd be all 5 what, 4 something, 3 smells. I'd be like, right. Now we'll put them up for reference.
Yeah.
But if I'm out and I can't remember them, can I just do 5 things a here, just make up, you know what I mean? Just work my way down. Yeah.
Absolutely.
Same effect.
Same effect, just taking it slow and focus on your senses. And the best thing about this strategy is you can't walk out of your house and forget your sight. You can't walk out of the house and forget your hearing, unless you're of a certain age. You know? And then you can always use this while you're walking in the park. When you're driving, I would suggest you probably stick to the sights and look at things outside. You can tailor this a bit more. So like for things like driving, running, you can pick things like audio podcasts. You can also look at things like audiobooks and things like that. Things that can distract your mind. Podcasts and audiobooks are really, really good at that.
Yeah. I love audiobooks and podcasts. But I never read books anymore. It's all audio.
Yeah.
So in terms of sort of self-care, I know that would be good if you're in a crisis or so, or if you're starting to panic, or if it's getting too much and you need immediate response. But in terms of everyday self-care, what's the best forms?
Yeah, so I would even be using that outside of that because it's one of those skills that works better the more you practice it. So even just sitting in the house and practicing it so that whenever you do need it in a crisis, it's much more effective. But general things that you can do for managing your well-being and preventing you getting to that point of crisis is exercise is one of the best things that you can do. So making sure that you're active, whether that's just walking.
I'm going to throw it out there, right? I don't have time to exercise.
Okay.
That's the common thing that everyone will say. I say it all the time. Okay. I don't have time to go to the gym.
Okay. So can you walk around the street?
Yeah.
Okay. That's exercise. Can you get yourself...
or what do you do at home that you can't do? If it's mental, you're thinking or whatever, you're planning something, plan it while you're walking. Yeah. You know, that type of thing.
Multitask. It's great. Yeah. If it's, I can't do it because I've got the kids, take the kids with you. Go for the walk. It may be a bit more stressful, but you're still getting out for the walk. And so we've got activity is really important. Social connection, I really can't emphasize enough how important this is. Loneliness is a strong maintaining factor for depression. And keeping a person isolated really, it brings that threat system online for us. We normally think of that threat system as really anxiety provoking, but it also brings a lot of anger and a lot of sadness for us. So whenever we're kind of more threat focused, we're going to end up really struggling because we're not looking after ourselves. So there's connection, achievement related activities can be really helpful too, learning things. So whether that's learning a new language, even if you just get Duolingo on your phone, it's free, start to learn a new language.
Or even a podcast as well.
Podcasts.
You can learn anything on a podcast.
Learn anything. So learning new things keeps your mind active, keeps you focused, and it also keeps you very focused on that behavioral activation thing that I was speaking about before for depression. So remember, you're doing things that give you a sense of achievement, enjoyment, and closeness to others. And if you're not getting those 3 things enough in your week, we are all vulnerable to depression. And that doesn't really matter. It's not that some people are protected from this. We will all be vulnerable to that, given that context and circumstances we find ourselves in.
A big part of Just a Chat is, we always say, if you're in Just a Chat, you understand. And we're like a big family. Like, we've got over 70 fellas in our group.
Yeah.
We've got 15 women and growing. You know, we're in the community loads. But there's times where I would be sitting at home and maybe I wouldn't be having a good day, and then somebody would just put something random into the chat, and next thing you know, he says this, and I'm sitting there just looking, laughing, smiling, and it's just a wee WhatsApp group that I'm not even texting into, and it's all this happens, but I know fine rightly, just through that building of relationships, that I can reach out to 40 of them people and go, I'm having it. See, if I put in that message right now, I'm having a bad day, the message that will come in as support is incredible, and sometimes it's good. It's like it releases, you know, endorphins, is it, or something? Just to feel that care around you and that good social circle.
Yeah.
But what I'm trying to sort of get into is, if I don't have people around me and I'm at home and I'm thinking, he's this or he's did this on me, and I overthink that and build that up, if I don't have somebody to rein me in and correct me or give me a different point of view, then will I then become better, do you know, to that person, if I don't have that social circle? Does that make sense? What I'm trying to sort of ask is in the importance of the people around you.
I think that it'll definitely raise all their threat system. Definitely it'll make things 10 times worse for them the more they start thinking along the lines of that person's either causing me distress, or they think of me like a horrible person, or they think they're better than me. Those kind of thoughts will definitely result in a lot of anger towards us, or anger towards other people in the group. It's the social connection bit. It links to a thing called our soothing affiliative system, and it's a really long evolutionary thing for us, is actually caring for other people. So somewhere along the line of our evolution, we actually got to the point where we started looking after the people around us, because otherwise, the group of people that we were living with wasn't going to survive. When we broke our leg, someone needed to be there to care for us. When we got ill, someone needed to be there to care for us. So if we didn't have a group of people doing that together, we weren't going to survive as a group. So eventually, over time, we learned to actually care for other people, and it just became a necessity for us. But we are also built in that hunter-gatherer times very differently to where we are now. Where we are now in society is we have our own little individual home that seems separated from everywhere, yet connected to everywhere. And that can actually compound things like loneliness and isolation, because although we live in such big groups, we don't necessarily feel connected to any of them. And so without that sense of belonging and acceptance from other people, we will always feel lonely and isolated. So this is where that social connection part is absolutely essential. If you're depressed or anxious or dealing with trauma, regardless of that, we need to feel a sense of belonging and connection to groups around us that accept us, because otherwise we'll feel really threatened. And in that evolutionary point of view, when we were in a hunter-gatherer tribe, if we thought that we were going to, for whatever reason, be kicked out of that tribe, we've done something wrong and they're going to kick us out, we weren't going to survive that. There may not be another group for thousands and thousands of miles, and if we needed someone to look after us when we were ill or had a broken leg or whatever it was, we weren't going to survive. So being kicked out of the group was a death sentence. This is why whenever we feel rejection, criticism, and whenever we feel that we're not going to be thought of in a kind way or in a caring way, we can get really threatened by that. It's a really long evolutionary thing.
Facing a mental health crisis? Just a Chat could be just what you need. Download our new app today for 24-hour access to mental health and well-being services in your area, with podcasts, support groups and more. It's the mental health first aid kit that's always worth having in your pocket. Find Just a Chat NI on Facebook and Insta.
So when you were saying about people are maybe fearful of losing the tribe, what happens, say for example, if I'm at home and I'm severe depression, severe anxiety, and I really, really want to get to these groups, I want to play football, I want to join a group, but I'm so low, I'm so nervous, or I'm so afraid, or all those things, that I can't do it?
Okay, so it depends again on the severity, first of all. If you're at a stage where you're in bed all day, every day, and you're not leaving it, you're probably in the realms of where you might need crisis intervention, something like a home treatment team, or possibly even along the lines of admission to a hospital. But that might be further down the line where most of the people here are struggling with. So even if they're spend a day in bed or a day or two in bed too much, first of all, the question you need to be asking there is, does that ever change anything for them lying in bed all day? It never changes anything, and unfortunately it just results in people feeling more tired. It results in muscle fatigue as well. So it actually becomes this vicious cycle of, I really want to do these things, but I'm going to spend all day in bed. My muscles are getting weaker and weaker the more I spend in bed, and then you're getting worse and worse the longer you're spending in bed. So you're pushing yourself further and further away from those things that you think are helpful for you. So again, back to those very big basics, the behavioral activation stuff is what motivation really is for, okay? You might want to set yourself a goal, something along the lines of, I want to get to that because it's important for me. I want to make my life worth living. You know, it may be something along those lines. So with behavioral activation, it can be something small. If you're lying in bed, it could be sitting up. That could be achievement. That's it. It could be getting a shower and sitting on the bed. You can start really, really small. It depends on where that person is, but starting to build up activity little by little and giving themselves credit for it compared to where they were maybe a week ago, 2 weeks ago, a month ago. That takes time and effort. No one can really do that for someone. But the other bit that I would say that's quite helpful is it's a bit of a snowball effect. The more you do, the more it keeps going. So there's a thing in a sort of phrase in physics where an object in motion stays in motion, an object that's not in motion will not be in motion. So it's the same sort of thing. If you keep going with things, you will keep going. But if you stop, you're going to stay stopped.
Yeah, and I think possibly people might see going to that group from bed is a million miles, and it's a huge goal that you can't just go out. It's like me, I can't turn around tomorrow and go, I'm going to run a marathon tomorrow, because I physically won't be able to do that. So if I go out tomorrow and I walk a mile, and then I walk 2 miles, and then I run for 1 mile, and then I run for 3 miles, and then I have a setback and have an injury, but I go again, then I can build myself up to that. And like you said, as in, like we always say in some of our workshops, if you can set yourself achievable goals, everybody loves achieving something, no matter how small or big, and that feeling helps. But if you can set your goals like make your bed, have a glass of water, and brush your teeth. And if you can do them 3 goals, say in the first 20 minutes of waking up, then you've achieved 3 things that day quickly. Then what's your mid-range goal for that day? And you can sort of build it up that way.
You get yourself a really good routine and structure. So even if you drew it out for yourself, right, first thing is get up, get showered, get ready, get dressed, make your bed. There's your 3 things to get done. That can change your whole mindset because of how much achievement you feel, but also thinking about, compared to where you were before, you need to keep telling yourself how far you've come and give yourself the credit that you're due, because that can be a long journey for someone. And as you said yourself, the running analogies are really great. I think they're brilliant. You wouldn't be able to do that going from lying in bed a couple of days a week to being in these groups. It's too much. But think about asking yourself, what can you cope with? What can you get to? Whereabouts can you get to? If it's being active in the house, maybe you can't go to yoga, for example, or go to something that's helpful for you, but can you do it in the house just with yourself as a prelude to go to
YouTube.
There's tons of stuff on YouTube.
All the training's on YouTube, apps on your phone, everything.
And if it's getting to the point where you feel you can go for a walk, even a small walk, think about a 5-minute walk, even up and down the street. That is a 5-minute walk more than where you were before.
But what happens when you walk to the shop? You might bump into someone, you might have a conversation, you might catch up with a friend, you might see someone that is having a bad day and you've just helped them. So there's lots of other things that can come from that.
For someone with social anxiety, that might be the thing that keeps them in the house. So maybe thinking about where you're not going to find anyone walking.
If you've
It's
social
about-
anxiety and you don't want to do that, put the headphones on.
Yeah.
Would that sort of work for that?
Possibly. With anxiety, there are a thing called safety behaviors, and they're basically things that keep you feeling anxious, because people who keep walking and only feel they can survive and cope with the headphones in, they're not attributing it to I can cope.
Okay.
They're not saying, look, I can go and do these things now. It's I'm only coping because I've got the headphones in. But
You're reliant
even
on them a
at
wee
once, you become really reliant on it. It can be a helpful thing to get you out of the house and do lots of things, and that's great as a starting point, but then you need to work towards removing those safety strategies.
And sort of if you can get up and say, for example, you are in bed so much and you're struggling to get out, and say, for example, you can get out and you achieve them 3 goals, you have your shower, you brush your teeth and you make your bed. How many people, if they did them 3 things, would get back into bed? Very, very little, I would say, because you've changed your mindset. And you're like, well, there's no point in getting back into bed if I've already done this.
Yeah.
And then it's almost like success breeds success.
Yeah, absolutely. And then it's thinking about, what else do you want to do with your day? What else do you think would be helpful for you to do? I think that's a question that in compassion focused therapy, there's a thing about developing your compassionate self, which is basically strong, wise, and has a deep caring commitment to alleviating suffering, both your own and others. And it's basically just a way of kind of structuring helpful activities for yourself and other people, and an identity for you as well. One of the things you can ask yourself from that compassionate part of yourself is, what can I do that's helpful that will look after me, or me and other people, or even just other people if you don't feel you're able to look after yourself today? That can be the starting point for beginning that compassionate journey for yourself. But it can be tricky.
Right, so a few people sent in a few questions. Now, a lot of the questions have been very similar. Some of the things we've already covered, so I'll just go over a few wee things and we'll just discuss in your view what, advice. And obviously, it's very hard to give accurate advice without knowing the person and the situation. So these answers are theoretical, advice.
Yeah.
So these aren't diagnosis, so to speak. So there's quite a lot of people are saying, what's the difference between anxiety and overthinking? I think we covered it a wee bit earlier on. It can be very similar, and the overthinking can lead to anxiety.
Yeah, the overthinking could lead to anxiety. Anxiety itself is an emotion, so people can get confused by that. There are anxiety disorders, and that would be things like social anxiety, panic disorder, OCD. You'll be looking at things like health anxiety as well. There's quite a wide range of like generalized anxiety disorder. Some of them have very similar components. Like if you worry a lot, then you're likely to have a higher likelihood of all of those conditions. So worry processes, it's like something that kind of goes between all of them. They all have it to some degree. But you may also have things like intrusive thoughts. So if you've got thoughts in your head and you're attaching meaning to it, you might be more likely to have things like OCD. We spoke a little bit about panic before and reacting to physical sensations and how that might be. One of the most chronic and unremittent of conditions is social anxiety. It is something that most people have to some degree. There's a lot of subclinical diagnosis or subclinical levels of social anxiety. So for anyone who gets a diagnosis of social anxiety, say it's a 7 on a scale, and then 8, 9, 10 is more and more severe. You can have loads of people around 6 and 5 on that who struggle a lot with social anxiety but never really get any help or support, and they just kind of expect it all to go away by itself. But unfortunately it doesn't go away, and usually you get people around 30 to 35 going, okay, better do something about this now. I've suffered with it for the last 18 to 19 years. So you tend to get people who suffer with it for a really long time before getting help and support.
Say, for example, I have suffered for 18, 19 years.
Yeah.
Can I still fix that?
You can definitely manage it and make it an awful lot better.
Okay.
But with a lot of things with mental health, you're really looking at managing it and reducing the impact and distress that has for you. Curing these things is not really, it's not really an expectation, because we all suffer with anxiety, sadness, anger, and things at times. We can all get trapped in these mental loops of overthinking things. that's human nature.
Yeah.
That's just how
So
we're
don't
built.
go into it thinking I need to fix this.
Yeah.
It's I need to manage it, learn
Yeah.
how to live with it, learn how to deal with the triggers and stuff like
Yeah.
that. So yeah.
And we're all vulnerable to it. It's not that there's some people that aren't. We are all vulnerable to it because we all have tricky brains that they're a bit of a mess at times. Okay, so our brains aren't structured in a way that are really helpful for us, and they cause lots of difficulties. So throughout evolution, there's like lots of pros and cons, different parts of our brain evolving and getting better, or getting sort of overcoming challenges. One of the ones is that we kind of recognize in evolution is that whenever we were able to stand up, it actually caused a lot of cons in terms of survival of our species, because it narrowed the birth canal and made birthing for women really awful and exceptionally difficult. So although it made things better and that we were able to use our thumbs and using our hands for tools and things, the other side of it was that actually it made survival quite difficult. And that kind of goes throughout our sort of evolution process, that there's always pros and cons. Our brains are not perfect, and nor should we expect them to be. It does lots of different things that cause us distress, and we're not always really aware of all those things that go on. Like, we don't think about our breathing. Those things are automatic. We don't think about how our minds can be really distorted in how we view things. Those are really just what goes on in our brain, like background processes on a computer. There's no point blaming the computer for it.
Yeah.
It's just the way it's built.
I think what you said there is very, very important in terms of everybody suffers with some form of anxiety and worry and stress. So if anyone is watching this and they are suffering, you're definitely not on your own, and don't think that you're on your own, because everybody has it. In terms of mental health as well, everybody has ill mental health at some point in their life.
Yeah.
It's just how you manage it. And it's the same with anxiety, it's the same with depression. Everybody can have that throughout their lives in different ways. So in terms of them, as we said at the beginning, the forms and the self-diagnosis, that will be a good starting point if you're
just to check out where you are
between overthinking and anxiety, and that question resists you, then maybe that'll be a good thing to do. So the
other thing that I think is quite helpful that I tell my clients who struggle with recognizing how important mental health is and their own suffering is, it's 1 in 4 who struggle with mental health. So when next time you're out in the town or out shopping centre, wherever, count every 4th person. That can help you recognize just how common it is and how much we all struggle. Yeah. And those are the people who have diagnosis. Yeah. Not even the people who are the 5 and 6 on the scale.
That are sitting here asking these questions. I'm in a bad state of anxiety and I'm overthinking too much. How do I snap out of it? I think the key thing there is, how do I snap out of it?
Okay. So the first thing is the grounding techniques would be really helpful. We've talked a little bit about those, but distraction to start with. You'll be kind of using that to try and refocus your attention into something else. But if it's a worry process, if you're doing lots of what ifs all the time, then you need to consider something like a worry management technique. There's a great worry management technique called worry zones, where you set yourself a sort of 20-minute, half an hour period to do all your worrying in, and then you sort of delay it the rest of the time throughout the day. So, for example,
do you literally plan a time to sit and worry and overthink?
Yeah.
That's mad.
But it's very tightly boundaried. Yeah. You're not allowed to worry at any other point during the day.
Oh, right.
So if you catch yourself throughout the day worrying or ruminating, playing things back from the past, you've got to jump into distraction as soon as you possibly can. Okay. You're trying to train your brain in a way that actually recognizes the worry and rumination and redirecting it to something that's more helpful. Okay. Eventually you're getting to a point where you don't need that worry time anymore, and you just focus on delaying those worries. Because if it's a hypothetical worry of what if, we can't do anything about that.
Yeah, no control whatsoever.
No.
That's a good sort of thing you're saying. Say if you're thinking that your child's worrying, is there any tools that a child can use?
Yes, a very similar technique that's been modified for children called worry monsters. Okay. They're available on Amazon for I think about 12 or 13 quid. Basically you write down a wee post-it note what the worry is, and you put it in the monster, and then you put the monster away. And so you're kind of getting to dealing with the worries, you've written it down, and then you're getting to the idea of, I'm putting that away for now, and I don't have to deal with that worry. And that can be really helpful if you do have a child that struggles with overthinking.
Yeah, I think we got quite a lot of questions relating to how to deal with anxiety, depression, self-care in children. I think that's a full discussion in itself. So one of our next ones, we will be doing something based on the children. Just if you think we haven't approached it, we're going to do a full episode on mental health and anxiety and stuff in kids. So we'll keep you posted on that. This is a very strong one as well. So how to believe that everything's going to be okay and work itself out when I've tried counselling, I've tried listening, I've tried taking advice, but it's still not working.
Yeah. So how do I kind of keep being hopeful of the future if things are really quite
If I did what people are telling me and it's all failed.
Okay.
Which, I think a lot of people think like that in terms of they're on waiting lists for 8 months, they've been to the GP, they haven't got this medication's not working. So what next if everything's not working?
Yeah. And look, I totally appreciate that that's quite common for people at the minute. It is quite a struggle. Trying to keep hopeful of the future is something that can be really tricky when you're really struggling like that. One of the things we'd normally recommend in this case is setting the kind of achievable goals to start with, thinking about that, but also thinking about whether you actually had the right help. I had a lot of people tell me that they had CBT, but whenever I checked in, they really didn't have CBT. They had really light touch sort of interventions that looked CBT-ish, but they didn't get the right help, basically the right help from the right trained professional. So one of the things is checking out a person's credentials. Are they actually trained to the level that they suggest they are? If you're needing someone like a more severe intervention, a talking therapy that guides you through what you need to do, you're probably looking at CBT. If you're looking at something that's a bit more like, I just want to talk about how I feel, that's more counselling. Okay, though I'm sure there's some counsellors that will nail me for that one.
Now, obviously, counselling is important. Every one of those is important. But it's important for the right person. So if you go to counselling, it doesn't work, don't give up. If you go to a psychologist, it doesn't work, don't give up. Same with psychiatrists. So it's a matter of finding the right balance. And there's lots of charities out there that can help. Even like, for example, if you are stuck, if you drop us a message, we can do that research for you. We can reach out to different charities to see if that's what they cover, and we can get you in touch, and we can signpost you and refer you into different things. So don't sometimes driving down that journey can be very difficult because you don't know how to do it. Whereas if you go through other charities and they can't help you, don't be afraid of asking what other help's out there, because all the charities all link up together. And also as well, if you are in that situation and you don't know what to do, join a group. Like, we've got guys in our group that have came from the lowest and now they're high, and we've got guys that come because they just like what we're doing. But being around like-minded people who are going through the same things, and in a group that offers you happiness, camaraderie, support, friendships, achievements, things like that. Like, if you seen our football team play, you would literally be like, why did they play football? So we've got boys of every ability, every shape, every size. But we don't go out to win. We don't go out to play. We don't go out to score goals. Some people do. And when you're on the pitch, it's different. But we all come off the pitch arm in arm with a little bit of, exercise, a bit of banter in the dressing room, things like that. So reach out to groups like that. There's chess groups, there's Weight Watchers groups, there's bingo groups, there's whatever it is. Just try and get your teeth into something, like.
Yeah, and you need to build that hope for yourself as well. There is a kind of built-in sort of profile in us all that's kind of waiting for rescue. I don't know if you've seen the film The Martian, with Matt Damon, where he's kind of stuck on the planet. First part of it, he's just sitting waiting about, doing nothing for himself, and kind of waiting for someone to do it all for him. Unfortunately, that doesn't do anything for us. But we all have that little profile in our head. Being able to be aware that that's there and recognizing, I need to do the other bit. I need to be my own hero here. I need to be my own best compassionate self and look after me and the people around me. That can make such a difference, because you're changing your motivation. You're not waiting on someone doing something for you. You're taking control of what is within your control, and you're doing something that's helpful.
Yeah, and I think what's important to reach out as well is, if you are feeling like it's still falling apart, and if it is bad, pick up the phone to the crisis lines. We will put up all the emergency lines here, and that's 24/7 support. So if you are feeling at the bottom, you feel there's nowhere else to go, please reach out to one of the following, and we will put them on this post as well. The correlation between depressed people and the guilt they feel at being depressed when everyone around them seems to be worse off.
Yeah, this is quite a common one that I would see in therapy. Somebody telling me, look, I feel sad and all these other people have it so much worse off than me. You know, I shouldn't be allowed to feel this sad. So unfortunately, that's another mental loop there where you've got these thoughts kind of driving that sadness, but also anger at yourself, the self-criticism, the anxiety about the future. Is this going to get any better? So unfortunately, you kind of get into that loop really, really easily. What can be helpful there is, again, trying to break that mental loop apart as much as possible through either those distraction techniques, mindfulness, the worry management programs. There's a lot there that breaks that apart in terms of that connection. Yeah, I've totally lost my train of thought with that one.
Do you know what? I think we have covered quite a lot of different things that you can do, and if you can take, like, these all won't work for everybody. So it's like, if you can take that and try it and go, no, not for me, that's all right. Try the next one. Try the next one. Try the breathing. Try the walking. Try this. Try the goals. So that's the thing, is what we're trying to achieve here is we're trying to let people know what you could do at home and how to get support. And we have covered quite a lot of things that you can do personally, and talk to somebody else close to you in your circle about these techniques, because a lot of people hide what they're going through, and maybe if they feel similar or whatever, maybe that's something that you can help them progress in and help them sort of, once you try and, like I always say, if I always learn something, I always try and talk to somebody about it, because it almost helps me remember it and helps me understand it more, and in another discussion, you know, that way. But it's the kids.
The feeling's probably more shame than it is guilt, and that's a tricky one. Guilt is actually seen as a helpful emotion for us, because it actually helps us repair relations, because you feel bad about it and you want to do something to make amends for it. You want to repair that relation. The emotion the person's probably feeling is more shame, because it's more about hiding that and about trying to keep that away from other people, isolating yourself from that. But basically, the more you're kind of minimizing the impact on yourself, you're also telling yourself you don't deserve to have those feelings. You don't deserve to be able to struggle with this. So everybody else should be doing better than you. The more you're doing that, the more you're criticizing yourself, the more you're going to just make your suffering worse.
Yeah. I think that's pretty much everything I wanted to cover today. Like I said, we will be doing another one coming up for more dealing with sort of kids directly. Hopefully you guys have got something out of this yourselves, and if you know someone that's suffering, please pass this podcast on, and if you need any help at all, please follow all the information that we've provided, and feel free to reach out to any of us. So just want to say thank you so much, Mark, and we'll hopefully see you again soon. All right?
Thank you.
Thanks everyone.